We are an orthopedic and trauma unit at UNC Hospitals. We monitor our central line associated bloodstream infections regularly and noted an opportunity for improvement. The focus was decreasing and sustaining a low rate of infection by targeting improvement in central line maintenance, as this is the work that the nurses can impact. Through this process, the central line associated bloodstream infection rate on this unit decreased from 3.2 to 0.6 infections per 1,000 catheter days over this 5-year period of 2008 through 2013, averaging over 1,600 catheter days annually. We implemented 4 cycles of interventions based on the Plan, Do, Study, Act PDSA cycles. Holly Rabinovich, our infection control liaison, became our unit champion for this project. The first cycle began with assessing and identifying nurse educational needs. She administered a test created directly from the central line care and blood drawing policy. Second, the unit champion had each staff nurse independently demonstrate central line dressing change and blood drawing techniques on the mannequin. She reviewed and remediated the procedural technique during that time if needed. The second cycle was a standardization of central line tubing and dressing change processes in conjunction with the Shared Governance Practice Council. This involves standardizing dressing changes to every Saturday and tubing changes every Wednesday and Saturday throughout the hospital. As a reminder to the nurses, the IV tubing and central line dressing changes were added to the nurse report sheet and the medication administration record. The third cycle incorporated more staff input in order to increase compliance and efficiency. This had the most impact on decreasing the central line associated bloodstream infection rate. Our nurses requested that the central line maintenance supplies be kept at the bedside. The unit champion infection control team developed grab-and-go bags that are suspended from the IV pole for the patient's stay. In the fourth cycle, Holly challenged our nurses to identify ways to include the patient in central line care, since nearly 50% of our patients go home with the central line in place. Our charge nurses rounded daily, encouraging patients and families to ask questions and teaching them the process for managing central lines. We placed a sign on the door to raise awareness for all staff. Lastly, charge nurses implemented an audit with one-to-one immediate feedback to ensure compliance to the policy. This project was a successful collaboration within the nursing team, Shared Governance Practice Council, and epidemiology to reduce central line associated bloodstream infection rates.